Hello, so today we are going to be talking about hormonal contraceptives. In this video, I'm going to be giving you a detailed summary of hormonal contraceptives, the types, the advantages, the disadvantages, and the side effects of the various types of hormonal contraceptive. So let's get into it. So first of all, what is family planning all about? According to the WHO, family planning allows individuals and couples to anticipate and attain their desired number of children, spacing and timing of their births. It is achieved through contraceptive methods and treatment of involuntary fertility. So now talking about hormonal method of family planning, which is one of the methods of family planning. The hormonal method of family planning does not only prevent ovulation, but also prevents fertilized egg from implanting in the uterus lining. Others cause the mucus in the cervix, that is the opening of the womb, to become thick and sticky, making it hard for the sperm to move and reach the matured ovum. So what hormonal contraceptive does is that it prevents ovulation, and even if ovulation occurs, it prevents a fertilized egg from implanting in the uterus lining. Hormonal contraceptives contain either one or two sex hormones, that is estrogen or progestin, that are similar to the hormones naturally occurring in the body that regulates pregnancy. Now, what are the type of hormonal contraceptive that we have? In this video, we're going to be talking about 6 types of hormonal contraceptive. First is the skin patch, the second is the IUD, the third is the oral contraceptives, and we also have injectables, implants, and vaginal rings. First, talking about the skin patch. The birth control patch is a small, sticky, transdermal patch that you wear on your arm, your back, your lower belly, or other parts of your body. It sends hormones similar to those in birth control pills or vaginal ring into your system through the skin to prevent pregnancy. So how does the skin patch work? The patch keeps one from getting pregnant by sending the hormones estrogen and progestin through the skin and into the bloodstream. The hormone keeps the ovaries from releasing an egg, thickens the cervical muscles to stop swimming sperm, and make it hard for any fertilized egg to implant inside the ovum. The patch works 99% of the time. That means 1 person out of 100 who use the patch might get pregnant in a year if directions are followed perfectly. Now, how do you use the skin patch? The skin patch is changed after 7 days and should be replaced on the same day every week. So if you start using it on a Monday, you keep replacing it every Mondays after 7 days. Some people skip the patch on the 4th week, while others don't. However, if you skip it on the 4th week, you will experience your period, and if you do not skip it, you may probably not have your normal menstrual flow. So what are the advantages of the skin patch? The skin patch provides a daily dose of estrogen and progesterone. Therefore, the patch may have other possible health benefits, including light periods, less blood and cramping, more predictable period, less anemia because you are losing less blood, less chances of ovarian cysts, certain cancers, and other diseases. Does skin patch have any disadvantage? Yes, they do. First of all, they are not best for persons that weigh more than 198 pounds. The patch may be less reliable for heavier people. It is also not best for people that are prone to blood clots, have breast or ovarian cancer, or take drugs for epilepsy, because the patch continually drives estrogen, which may raise the chances of this problem slightly more than regular birth control pills does, which may raise your chances of these problems that have been mentioned. What are some side effects of using the skin patch? Not everyone may have this side effect though, but some common issues that are associated with the skin patch include headache, tender breast, nausea or vomiting, rash or redness where you place the patch, mood swing, menstrual cramps. So finally, on the birth control patch. The birth control patch is a safe and effective form of birth control that requires weekly attention. People who wish to avoid getting pregnant simply need to stick it on and change it every week. The second type of hormonal contraceptive is the intrauterine device, popularly known as IUD. The IUD is a birth control method that sits inside your uterus. A hormonal IUD is a small piece of flexible plastic shaped like a T. The hormonal IUD releases a tiny amount of hormone progestin into the blood over several years. Hormonal IUDs cause the uterus to become inflamed because the human's immune system responds to the IUD as a foreign body. The inflammation of the uterus makes it inhospitable to both sperm and potential embryos. The inflammation response prevents pregnancy on 2 folds: by preventing sperm from reaching and fertilizing an egg, and by preventing any fertilized egg from implanting in the uterus and developing into a pregnancy. So this is a pictorial representation of what the IUD looks like. You can see it inside the uterus looking like a T in there. The hormonal IUD also prevents ovulation in some women because high levels of the hormone progestin can suppress ovulation. Because hormonal IUDs mainly work by releasing a hormone that controls fertility, the device does not need to fit perfectly within the uterus to be effective. This quality makes hormonal IUDs a viable option for most women, even those with abnormal shaped uterine. Hormonal IUDs are considered long-term reversible birth control because they can remain effective for 3 to 5 years. IUDs are easily removed, and once removed, fertility can return within months. An IUD placement usually takes between 5 to 15 minutes, however. So what are some advantages of the hormonal IUDs compared to others? It is highly effective, more regular period, less risk of certain cancers, and the hormonal IUD can also be a good option for people who are unable to use contraceptive containing estrogen, including those who have migraines or higher risk of blood clots in the leg. Other advantages include reduced chance of human error. Once the IUD is inserted by a healthcare professional, the individual does not have to worry about forgetting to take a pill or use a condom. It provides long-term contraception. Some hormonal IUD are safe to use for 5 years. It also provides protection against pregnancy-related health issues. And finally, it is also very affordable. Do hormonal IUDs have disadvantages? Of course they do. First of all, pelvic inflammatory disease. In a small number of people, however, an IUD can irritate the uterus and cervix, causing a painful condition called PID. This risk is only present for the first month after insertion. Also, in some very few cases, the IUDs may come out, and it may also cause pregnancy complication. It does not offer any protection against sexually transmitted infections also. Some side effects of the hormonal IUDs include proliferation, headaches, angst, breast tenderness, irregular bleeding, mood swings, cramping or pelvic pain. Insertion pain may also occur. Now, going to the third type of hormonal contraceptive, the oral contraceptive. The oral contraceptive, also called birth control pills, are a safe and reliable option for preventing unwanted pregnancy. Most oral contraceptives contain a combination of two types of hormones, an estrogen and progestin. Both of these hormones are naturally found in a woman's body. There are many different types of estrogen and progestin, and different types of pill containing different combinations, but they all work similarly. Some pills contain only progestin, sometimes called the mini pill. However, a combination of progestin and estrogen prevents pregnancy by inhibiting the release of the luteinizing hormones and follicle-stimulating hormones from the pituitary gland in the brain. The LH and the FSH play key roles in the development of the egg and preparation of the lining of the uterus for implantation. Progestin also makes the uterus mucus that surround the egg more difficult for sperm to penetrate and therefore for fertilization to take place. In some women, progestin inhibits ovulation. So who can take the oral contraceptive? Most important requirement for women taking oral contraceptive is that they must remember to take them every day at approximately the same time of the day. Oral contraceptives are not a good form of birth control when doses are missed frequently. Combination oral contraceptive should not be given to women older than 35 years who also smoke, because there is an increased risk of blood clots in these women, heart disease, liver problem, very high cholesterol, and history of blood clots, and a history of stroke or breast cancer. So what is the best way to take the oral contraceptive? The oral contraceptives are usually prescribed for 4 weeks at a time, with each 4-week pack containing 4 to 7 days of hormone-free pills. Women get their periods during these hormone-free days. Some preparations have extended or continuous hormone dose with fewer or no hormone-free days, so that women get their period less than once in a month. Oral contraceptives can be started at any day of the week and any day of the menstrual cycle. All women who start taking oral contraceptives should first have a pregnancy test to make sure they are not already pregnant. Women should also use backup birth control, such as condom, for 7 days after starting. This is important to give the drug time to start working effectively. So how effective is the oral contraceptive? If the oral pills are taken perfectly, that is 100% of the time, the chances of pregnancy is 0.1%. However, in the real world, accounting for missed days of use, the chances of pregnancy is about 8% per year. What are some advantages of the oral contraceptive? It does not interrupt sex. It usually makes your bleeding regular, lighter, and less painful. It reduces the risk of cancer of the ovaries, womb, and colon. It protects against pelvic inflammatory disease. It reduces the risk of fibroids, ovarian cysts, and non-cancerous breast disease. Disadvantages of oral contraceptive. It can cause temporary side effects at first, such as headaches, nausea, breast tenderness, and mood swings. It can increase your blood pressure. It does not protect you against sexually transmitted infection. Breakthrough bleeding and spotting is common in the first few months of using the pill. It has been linked to an increased risk of some serious health conditions such as blood clots and breast cancer. Side effects of oral contraceptives include nausea, headaches, breast tenderness, weight gain, irregular vaginal bleeding, and mood swings. The next type of hormonal contraceptive is injectables. Injectable contraceptives are artificial hormonal preparations administered by a deep intramuscular injection into the muscles of the arm or the buttocks to be effective immediately. From the injection site, they are slowly absorbed into the bloodstream and the body gets sufficient level of hormone to provide contraception for 1 month to 3 months, depending on the type of injectable contraceptive used. Injectable contraceptive can consist of progestin-only preparation or combined estrogen and progesterone combination. Progestin-only combination contraceptives include DMPA and NET-EN. On the progesterone-only preparation, DMPA is an artificial progestin preparation which resembles the natural occurring female hormone progesterone. It is usually given in doses of 150 mg, which gives 3 months protection following injection. DMPA is very effective. In the first year of use, only about 0.3 pregnancies per 100 women occur. That is 1 pregnancy for every 333 clients who do not get pregnant, provided that the injection is given every 3 months. What are some advantages of the progesterone-only injectable contraceptive? It is very effective. It maintains privacy because you can use it on your own when trained. It is reversible, that means you can go back to fertility. It is suitable for breastfeeding women. It does not contain estrogen side effects. It is the best option for those with peptic ulcer disease. Progestin injection do not increase the risk of high blood pressure or blood clots. It protects against ectopic pregnancy. It reduces the risk of developing certain cancers such as cancer of the uterus, pelvic inflammatory disease, and iron deficiency anemia. Disadvantages of the progesterone-only injectable contraceptive include it disturbs the menstrual cycle, it does not have any protection against STIs, and if ovulation occurs, the chances of ectopic pregnancy increases. Other disadvantages include increased appetite causing weight gain for some women. Other side effects include headache, dizziness, breast tenderness, nausea, hair loss, angst, and loss of sexual feeling. For the combined estrogen and progesterone preparation, which is the CIC, it is a combination of short-acting estrogen and long-acting progesterone that is administered by intravenous injection to give protection for 1 month. And these are the type of combinations that occur. Effectiveness and advantages. As commonly used, about 3 pregnancies per 100 women using monthly injectables over the first year. This means that 97 of every 100 women using injectables will not become pregnant. It is effective if used consistently and correctly. That is, coming back every 4 weeks is very important for great effectiveness. Advantages include it does not require daily action by the user. It can be used privately if trained. Injections can be stopped at any time, and it is good for spacing baths. Some disadvantages and side effects include slightly delayed return to fertility, an average of about 5 months, and does not have any protection against sexually transmitted infection or HIV. Side effects include changes in bleeding pattern, weight gain, headache, dizziness, breast tenderness. The next type of hormonal contraceptive I'm going to be talking about in this video is the implants. Implants are a type of hormonal birth control which works by releasing progestin hormone into the body to prevent pregnancy. The implant is a very small plastic rod about the size of a matchstick which is inserted into a woman's upper arm right under the skin. Progestin prevents pregnancy by blocking the release of egg from the ovaries. It also thickens cervical muscles to prevent sperm from entering the uterus and thin the lining of the endometrium. So these are a pictorial representation of what the implants look like and how it is inserted right under the skin. Who can use these implants? Most women can use contraceptive implants, but it may not be suitable for women who take other medication that may affect the implant effectiveness, and women who think they might be pregnant, and women who have unexpected bleeding in between periods or after sex, and women who have liver disease, also those who have breast cancer or have had it in the past. And it is also not suitable for women who have arterial disease or a history of heart disease, and it is also not suitable for women who don't want their periods to change. Advantages of implants include: implants are a very good option for women who cannot use the estrogen-based contraceptive. It works for 3 to 5 years depending on the type, and it is safe to use while you are breastfeeding, and it does not interrupt sex. Your fertility will return to normal as soon as the implants are taken out, and it may reduce heavy periods or period pain, and it is 99% effective, and it is reversible. You can easily go back to fertility. Some disadvantage of the implant is that it does not prevent against sexually transmitted infection. Menstrual period may be irregular or may stop altogether. Temporary side effects may occur during the first few months, such as headache, nausea, breast tenderness, and mood swing. A procedure is needed, however, to have it fitted or removed. An increased risk of non-cancerous ovarian cysts. Mild insulin resistance may occur. Vaginal inflammation or dryness may occur, and weight gain may also occur. Finally, on the implants, contraceptive implants are highly cost-effective forms of long-acting reversible contraception. Pregnancies are rare in women using this method of contraception, and it has a high safety profile with its use failure rate at 0.5%. The last type of hormonal contraceptive we are going to be talking about in this video is the vaginal ring. The birth control ring, also known as the vaginal ring or the ring, is a safe and convenient birth control method that works really well when used correctly. It is a flexible ring worn inside the vagina, and it prevents pregnancy 24/7 by releasing hormones into the body. There are two types of birth control rings, the Nova ring and the Anovera ring. This is a pictorial representation of what the vaginal ring looks like. So how is the vaginal ring inserted and removed? To insert the ring, with clean hands, squeeze the ring between your thumbs and finger and gently insert the tip into your vagina. Gently push the ring inside your vagina until it feels comfortable. To remove the ring, with clean hands, put a finger into your vagina and hook it around the edge of the ring. Gently pull the ring out. Put it in the bag provided and throw it into the bin. Don't flush it down the toilet, however. Removing the ring should be painless. If you have any bleeding or pain, or you can't pull it out, see a gynecologist or nurse immediately. How does the vaginal ring work? The ring works by stopping the fusion of the sperm with an egg, which is called fertilization. Like most birth control pills, the ring contains hormone estrogen and progestin. These are similar to the hormones our bodies make naturally. The ring is worn inside the vagina, and the hormones are absorbed into the body through the vaginal lining. The hormones in the ring stop ovulation. No ovulation means there is no egg hanging around for sperm to fertilize, so no pregnancy can happen. The vaginal ring hormones also thicken the mucus in the cervix. This thicker cervical mucus blocks sperm and therefore prevents it from swimming or fusing to an egg. It's kind of like a sticky security guard. So how is it used? The standard way to use the ring is to leave it in for 21 days. Remove it and have a 7-day ring-free break. During this 7-day ring-free break, there's a protection against pregnancy. After the 7-day break, a new ring can be put in for another 21 days. Some facts about the vaginal ring include: if used correctly, the vaginal ring is more than 99% effective. But people aren't perfect and it can be easy to make a mistake. So in reality, the ring is about 91% effective, meaning that about 9 out of 100 ring users get pregnant each year. One ring provides contraception for a month, so you don't have to think about it every day. You can also continue to have sex when the ring is placed in. Unlike the birth control pill, the ring still works if you have sickness like vomiting or diarrhea. The ring may ease menstrual symptoms, and bleeding will probably be lighter and less painful. More facts include: some women have temporary side effects, including more vaginal discharge, breast tenderness, and headaches. A few women develop a blood clot when using the ring, but this is very rare. The ring can sometimes come out on its own, but you can rinse it in cold or warm water and put it back in as soon as possible. However, it does not protect against sexually transmitted infection, so you may have to use condom as well. Advantages of vaginal ring include: it does not interrupt sex, it is easy to put in and take out. One does not have to think about it every day or each time you want to have sex. Unlike the pill, the ring isn't affected if you are sick or when one has diarrhea. It may help with premenstrual symptoms, and period type bleeding usually become lighter, more regular, and less painful. Disadvantages of vaginal ring include: it may not feel comfortable inserting or removing it from the vagina. Spotting and bleeding may be observed in the first few months of use. It may cause temporary side effects such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood swings. The ring doesn't protect against sexually transmitted infection. One may need to remember to change it and put in a new one, and for some this may be difficult. Some medicines can make the ring less effective, and it may take a while for you to return to normal fertility. In some women, this may take up to a few months. Those are the precise details for the 6 different types of hormonal contraceptives that we have. Now, generally, what are the benefits of hormonal contraceptive compared to other types of contraceptive? The biggest advantage of hormonal contraceptive is their reliability. Studies have shown that only about 1 out of 1,000 women get pregnant per cycle if they take the pill or use the contraceptive skin patch or vaginal ring properly. Hormonal birth control prevents ovulation, so when ovulation doesn't occur, the uterus doesn't experience the painful contraction that cause cramps during ovulation. Hormonal birth control may also provide some relief for pain during menstruation. Hormonal contraceptive also reduces the risk of ovarian cysts. Moving on, what are some disadvantages of using the hormonal contraceptives? Hormonal contraceptives can cause blood clots, and this can lead to heart attack or strokes. The use of hormonal birth control carries an increased risk of short-term infertility among women who take the birth control for 2 years or longer. I hope you have learned a lot about hormonal birth control in this video today. If it was helpful, please give this video a thumbs up, and you can also share this video with others who you think will need this knowledge.